All right, we now have Hakeem Angula speaking to us about the importance of human social networks in Madagascar.
Hello, everyone. My name is Hakeem Angula. I'm a sophomore here at Harvard College, pursuing a joint concentration in computer science and statistics with a secondary in African American studies. This past summer, like my friends and colleagues who presented before me, I traveled to Madagascar with a Planetary Health Undergraduate Scholars Fellowship to do some environmental science and public health research. And now I shall present my findings: human networks in health, social determinants of health in Madagascar. So I first got interested in planetary health because I saw it as an intersection of several of my passions: public health, environmental health, and social justice. However, it wasn't until I was in Madagascar that I realized a key component of public and environmental health is, in fact, one's social relationships. In rural settings where resources like hospitals and medicine and well-trained medical staff may be scarce, your family and friends play a much larger role in your health. It seems so intuitive. In the wake of environmental degradation and its effects on human populations, familial and friendly support becomes more than just a social courtesy. It becomes an integral part of survival. So during my preliminary research, I examined an often used tool to determine health policy, the WHO's Standard Health Impact Assessment. And as the first of its listed determinants of health was an individual's social and economic environment. Now, things were tying together even more robustly, and I found little quantitative evidence to show that one's social and community networks had bearing on their health. And as a computer science and statistics major, I thought that my passion and skill set would be best utilized to fill that gap in Madagascar. So in my project, I more explicitly and quantitatively examine the effect of one's social networks on their health and nutritional outcomes. This project is focused on two villages, Antaravatu and Vinanibe, with 180 and 105 households, respectively. A household here can be interpreted roughly as a family with around 5 people in each household. Now, these two communities are ideal because they represent the rural Malagasy context well, and the Maheri team has very good relationships with the community members. Now, with the location, I had to start thinking about the most important and contentious question of my project: how does one measure social relationships? Now, prior research presents a few ways, but the way that this project measures social relationships is by weighting them based on their familial ties. Here, we have some examples of social relationships and the weights that each relationship is given for the purposes of this analysis. For several years, the Maheri team has been collecting longitudinal data on the health and nutrition and kinship for Antaravatu and Vinanibe, and I've used those data sets for analysis. My first step was to construct a network or sociogram. Here, we see the sociogram of the two communities that I'm studying. There are clear clusters with all households connected to another one in some way, and with most households having many connections. Diving more deeply into this network, and the data about these connections, one will see the value of kinship. Here we have the degree distribution of the network. Now, as you can see, many households have 6 or 7 connections, but quite a few are in the range of 10 to 30. In fact, the mean of the number of connected households for each one household is 22, and this tells us key information about what to expect for the average household, that they'll be connected to at least 22 others in some way. Now, since we have a network image and an understanding of the average household's connections, we can dive into the health and nutritional outcomes. The first of these, and the most interesting in my opinion, is malaria prevalence. Now, I chose this photograph because it depicts a bad habit that is a manifestation of a number of different factors, from lack of resources like proper fishing nets to lack of social pressure and education. In addition to more abstract concepts like social pressure, one must also understand that for a lot of these resources, including mosquito net allocation, individuals go to collect these nets when they're dropped into the communities, and it's the families and households that are most closely connected to these individuals that get these resources first. It's clear that proper usage of mosquito nets reduces the prevalence of malaria. In my analysis, in particular, I showed that you're up to 6 times more likely to contract malaria if you don't use mosquito nets. Hence, I wanted to see the connection between mosquito net usage and the strength and breadth of one's social network. And I got this. Shown here is the fact that those households that use nets had a higher degree, shown by the mean here. On average, the household that uses mosquito nets is connected to 10 more households than the household that doesn't. This connects with and corroborates with our intuition. Good habits spread, and that spread improves health. But the correlations don't stop there. Similar results are shown for households that do prenatal visits, which have been shown to reduce infant and maternal mortality, a key result for Madagascar, where maternal mortality is very high. Then you dive into nutritional outcomes, which have a huge bearing on health, and you see the same results. Levels of iron, vitamin A, ferritin, triglycerides, and I could go on. They're all higher with households with higher degrees. It tells us, at the very least, that there is a relatively reliable correlation between good health, nutrition, and habits, and having a strong and well-connected social network. It tells us that, yes, the interventions that people make in these communities that give aid in the form of medicine and staff are very important, but it's also important to empower these people and their culture so that they continue to build strong networks and relationships. In the spirit of honoring social relationships, I'd like to thank the people who made this trip possible by supporting or inspiring me on some part of my journey. Thank you.